This episode of Common Health is brought to you by Reg Lantern. Reg Lantern is a straightforward and easily understandable software platform built to assist community health centers in staying compliant so they can focus on serving their patients rather than paperwork. For health centers that are serious about achieving, managing, and maintaining compliance, Reg Lantern provides a comprehensive approach and is an affordable and valuable solution. Reg Lantern can help your health center. Contact them today at reglantern.com. That's REG, as in regulations, lantern.com. For special discounts, mention that you heard about Reg Lantern on the Common Health podcast.
Hello, and welcome to Common Health from the Virginia Community Healthcare Association, or VCHA, or what we're also known as is VACHA. I'm Tracy Douglas, VACHA's Chief Executive Officer. On Common Health, we're amplifying the voices of community health, both those who give care and those who need it. And we are here today with a very special guest that I'm extremely excited to have join us today. And I think you two are going to find our conversation today very interesting and very telling. Today we have Dr. John Whyte. He's a board-certified internal medicine physician and chief medical officer for WebMD. But not only that, this is what's so interesting. He has such an interesting background, and he brings so much health information that we're going to learn from him today. But he's also still practicing. He is still practicing as a primary care physician. And with everything else that he's doing, he's still able to touch individuals and continue to make them and keep them healthy. With that, I'm going to kind of start out a little bit, because what I want to do, John, is, I can sit there and talk about all the different things that you've done and all the different accolades. But, I really want to talk and hone in on, given everything that you have done and are doing, you still want to practice medicine. You still want to touch a person. Talk to me a little bit about that. Why still do that?
Right. That's right, Tracy. And there are many days when I do ask myself, why am I still doing it while multiplying it and managing other jobs? And the reason why is it's so unique to have that special relationship with a patient, whether you're a physician, a nurse, or a pharmacist. Nothing can replace that. And I can talk about broad issues of diabetes or payment policies or whether insurance should cover something or not. But it all comes down to that one-to-one interaction with a patient and how you can see you might have an opportunity to improve someone's life, to diagnose disease early, to manage chronic disease. And often when people come to the doctor, they're at their most vulnerable. And you want to be there for them. And it's really such a great balance, because in many ways, as a chief medical officer, you can be going to what seems to be, these important meetings one day. And guess what? The next day when I go to clinic, it's extremely grounding.
Right.
Nobody cares that I was on a TV show or meeting with a member of the cabinet. They want to know about their metformin, or they want to know about labs. So it really grounds you, and it reminds you why we're doing this. We're doing it to improve people's lives. And sometimes as we move up in the hierarchy, we forget that and we lose that focus. So I've worked hard to have that balance. And so when people talk about burnout and people talk about the challenges of practicing medicine, I don't do it every day, but I can relate to it because I've been doing it, at least every week for the last few decades.
And where are you practicing? Are you practicing in Virginia, Dr. Whyte?
I practice in Virginia, but over the past 10, 15 years, I've practiced in the DC, Maryland, Virginia area. So as you may know, often you need to be licensed in all three jurisdictions. So right now, my practice is primarily in Northern Virginia, but I've also done it in the Washington, DC area, as well as Maryland.
We're going to talk a little bit, we're going to talk a significant amount around health literacy and what that is and why that's important. But I do want to hear from you. In the last couple of years, with going through the pandemic, can you talk just a little bit about what it is that you got? What did you learn from this experience here? What did you learn from your patients? What did you learn about yourself as we were dealing with this pandemic?
One of the things that I've learned is the importance of quality information and the importance of trust. So, a big challenge during the pandemic has been there's been a lot of misinformation, a lot of disinformation. People are going to sources and persons that weren't credible or were trying to sell something. Sadly, Tracy, we moved away from this idea where people would say to me, I don't understand science, to almost, I don't believe in science,
Mm-hmm.
or that's your opinion of the data, but I have my own opinion and they're equal in interpretation. And that's not always the case. I'm not an expert in finances. I'm going to rely upon other people to advise me. In many ways, we want patients to rely upon the doctors. And it was a challenge during the pandemic. We often told people not to come in. It wasn't safe, or it was hard to get an appointment, or they were fearful of getting an appointment. And we're not the best in customer service. None of us are in terms of responding to patients. So they turned to other sources. We saw a tremendous increase at WebMD, and we worked very hard to provide the best information out there at the time that we knew it and change it. But often there was a false narrative. And that's the biggest concern that I have in terms of the amount of misinformation out there that, when you talk about it in health, harms lives and harms people. So I get very frustrated over that. I get very mad over that. People are well-intentioned. They want to find good information. And unfortunately, there's a lot of bad actors out there that, are really creating more problems.
So that's a great segue into really what we want to talk about, and that's around health literacy. Do you think, and again, audience, we're going to define health literacy in just a minute, but sticking with this topic around the pandemic, do you think part of the reason why you had so many individuals questioning science now is because of where they were as far as literacy and understanding, really some of what's behind the health conditions and illnesses and things like that?
Absolutely. In medicine, we really have our own parlance. We use, these words that people don't know that, we start to think are commonplace. It's hard to understand clinical trials and how they're designed and what these studies actually showed and didn't show. But what happened is we didn't always have good messengers. We didn't explain it to people. We talked down to people. We didn't listen to them. We implied they were stupid if they didn't agree with us. All the wrong things in health communication. This idea that somehow you should do it because I, as the doctor or the pharmacist or the nurse, told you to, that might have worked 5-10 years ago. It doesn't work today. In some ways, the internet can be a great equalizer in a way in terms of getting information out there. But you have to go to the right sources. You have to have credible messengers. And sometimes people think, and I've heard this from patients on a variety of things. I read it on a blog, or, this person has an Instagram handle and has a lot of followers. That doesn't mean that their information is accurate. The problem is we didn't really spend time talking with people. We talked around them. We talked down to them. We talked at them. We didn't really have the conversations, and we didn't address their concerns. Even the way we phrased things, anti-vax, is that the best phrase to use for people? As opposed to, I heard a lot of other people were saying vaccine inquisitive, meaning they just weren't sure yet. They want to make the right decision, but we didn't always help them to do it. And part of it was, we're all so busy. The problem is, which we'll talk about, all doctors think they're good communicators. I've never met someone who thinks they're not a good communicator, but they often are not. I've learned that from interviewing a lot of doctors over the years. They're not necessarily the best. And then we also didn't look for trusted sources in the community enough that we should have. So it's been frustrating. We've learned a lot from it, and I hope we make some changes in really addressing how we communicate with patients, in the future. It's good lessons learned, even for the management of chronic disease.
So, Dr. Whyte, tell us, what is the meaning behind health literacy?
Yeah, and I don't want to use the whole parlance, the usual definitions, but when you fundamentally think about it, there's issues of reading and writing and speaking, but it's really about, are patients able to comprehend written text, right? In terms of the ability to read and understand. So, what does take 2 pills twice a day mean? What does, if you take a statin, that's going to reduce your risk of a heart attack by 10%? I mean, these are some of the challenges that are very practical in terms of, what we mean by it. And, that's what I'm very focused on in terms of really, how we communicate to people, because they have to get the information, right? Obtain that information, but they have to be able to process it, to understand it in the language that it's being delivered in as well. And that's where we have a lot of challenges, that people aren't able to read to the comprehension level that medical information, health information is often presented in.
So, when I think of health literacy based off of how you just explained things, I think that culture and ethnicity makes a tremendous, has an impact, right, on the effectiveness of how a provider communicates with their patient. And when I think of, say, for example, the African American community, which is a large portion of the population that we serve here in the Commonwealth of Virginia, federally qualified health centers. And when we look at some of the statistics coming out as it pertains to understanding, right? What is it that a provider would have to do in order to accommodate the different cultures out there so that folks can pick up what they need to pick up from their provider?
Right, because we're talking about, you're trying to obtain and read and process this information to impact and make appropriate health choices, right? So we have to be able to communicate the information in a way that people can understand and then make decisions. And sometimes there are some cultural issues around, particularly as we're giving people lifestyle changes as well. One example I'd use, which kind of touches upon this, is, some people in the African American community, and I trained a bit in the South, would talk about they have a touch of sugar, right? That doesn't sound so bad, does it? When you say that, it's just a touch of sugar, and we're talking about diabetes, right? Or pre-diabetes. I'll tell you, 9 times out of 10, when they say have a touch of sugar, they actually have diabetes. But the point is, because how they're presenting it, how they're talking about it, it doesn't seem that serious, does it? But it really is serious and leads to complications. When we give people advice, we have to recognize the cultural issues around it. And that is in, all populations. So in some clinics where I'm at, there's a African population, and by that I mean from the continent of Africa, and how their culture relating to certain meals is different in food. So how we give that information has to be culturally sensitive. It's the same in the Hispanic community, the African American community. So that's something that we're often not sensitive to, some of the cultural aspects as well. But again, what we too often do, Tracy, is we present the information. We don't ask them if they understand it. We don't use some of the strategies that we can talk elsewhere about, teach back, talk back. And that's the concern. We just kind of give our directions and move on our way and assume that people will follow it. And we treat everyone the same. right?
Yeah.
Whether you're a man or a woman, you're black or white, you're 60 years old or 16. And that is not effective communication.
So then tell me, what are some of the best practices out there then for providers? And I would think it wouldn't just be providers, Dr. Whyte. I think we would also look at other individuals within the clinic setting, right? It would be that front desk person, that nurse, that medical assistant, that billing person. What are some of those best practices that we could adopt in our health centers?
Those are all critical people that we forget about because they are the first touch points with people in the community. And, doctors often like to joke that often your review on some of the online sites is about parking, how long they had to wait in the waiting room, or whether people were rude to them or not.
Right.
And not necessarily about whether they were getting good care. But, I joke about it, but that does have an impact on people's mood for the day, right? If they're starting off in a bad mood, in terms of whether or not you really care about them, or you feel you're just a number, or I'm just being processed. So part of it is recognizing, and I learned this a few years back, even if someone can speak a language and sounds pretty fluent, doesn't necessarily mean they can read a language, right? So that's important. Where I work, we have somewhere in the chart that specifies what is the patient's primary language. And how do they want to receive, what language do they want to receive information in, right? Because that's important to know. I often use a teach back method where I ask patients, okay, tell me what I just told you. Or sometimes I say it like this, okay, so tell me what the plan is. I do it after I usually print something called the after visit summary, which a lot of doctors' offices use to kind of go over everything. But a lot of that has pre-packaged information too, right? And patients aren't always going to read that. So I say to them always, okay, so tell me what the plan is. Tell me what you're going to do. And, I'll tell you lots of times than I would think, patients haven't given me back exactly what I think I told them what to do. So that's very important. Even when the medication is listed on the prescription, I have found sometimes people don't follow that directly. So asking you to tell me what it means, not just what it says, but what it means, is very helpful. To ask them about challenges that they may have, at work. No one really wants to admit that they don't understand something. So you have to give them the opportunity to be okay with admitting they don't know how to read well or they don't understand it.
And I was just getting ready to ask you, how can we, a patient, help their provider kind of come down at our level, right? And make us feel comfortable enough to where we want to share our vulnerability, right?
Absolutely. And it's about those relationships. Everybody wants to be a good patient. People want to be a good doctor, but I have a fair percentage of patients. They want to please the doctor, right? You say the right answer. You just nod your head. I'll tell you, when I see patients nodding their head too much and not engaging in conversation, I think something's going on. I want to hear dialogue. I want people to explain back to me what I'm saying. I want to understand if it's practical or reasonable. So sometimes I see patients where they might need to take a couple of days off of work because of either they have to manage their condition, they have bad pain. I always talk to them, and everyone doesn't do this. Are you able to take time off of work? I ask them if they have sick leave, and I ask them if they can use it. Because I've heard from people, especially those in maintenance and other areas, if they don't show up, it's going to be a problem. So you have to acknowledge that these are challenges. And I say a lot of people aren't able to take time off work, even if they have sick leave. Are you able to take time off of work? If you have a note, how many days would you be allowed to take off? I talk to them about, it's hard to remember to take meds. And I might say, I sometimes forget to take meds because I want them to know it's okay to acknowledge you're not a perfect patient. It's okay to acknowledge you don't understand what I'm saying. And you don't want to, again, talk down to people, be like, hey, does that make sense to you? Do you know what I'm saying? That's, people, of course, are going to say yes. So you want to have more open-ended questions too, right? Not just let them respond yes or no. Hey, did that make sense? What's someone going to say? Yeah. The problem is, though, as you know, our appointments are too short.
Yeah.
Everything is so rushed.
Yeah.
And we're not spending enough time as we need to. We're not utilizing other resources as well, too.
Right.
You know, we could have nursing teams make sure they engage with the patient afterwards. We could make sure the front office staff, when people leave, make sure that they don't have any other questions. And if they do, you know, let's get the doctor back. It requires changing the culture a little bit. And it's hard right now where there's a lot of burnout and people are overworked and have a lot of challenges going on with mental health. But now's the time to reshape and rethink how we deliver care. Because something that I've learned, you asked that at the beginning, something I've learned is, and we always kind of knew this, but I think we're finally paying attention to it. Health happens outside the doctor's office. Right. So yeah, I care what your blood pressure is in the doctor's office. I care what your heart rate is, what some of your labs are. But what I really care is what's happening at home. What's your access to fresh fruits and vegetables? What's your ability to walk around your neighborhood in a safe environment? What's your blood pressure doing at home? What's your glucose doing if I can get you a continuous glucose monitoring? What's happening there every day? It's not as, in some ways, important what happens when you come in once a year or once every 6 months, but what's happening when you're not here in the doctor's office, and how do I continue to engage and dialogue with you? How do I help you think through any digital apps, all the trackers that people are using? How do I make sure that we equalize access to those, that only those that can afford it don't get these additional services? So it's really a lot of thinking through, because even when we talk, Tracy, about health literacy, it's not just health literacy in the doctor's office then. It's the health literacy about all these apps, all these digital tools, all these other devices, which really could be interesting. But how am I going to help you use them?
Right.
Everyone wants to talk about heart rate variability.
Right.
I'm not always sure what it is. But my point about that is there's lots more exciting things that are going on. And what COVID has taught us, at the end of the day, all we have is our health. Obviously our family too. But if we don't have our health, we have nothing.
Right.
So do our jobs really matter?
Right.
All the other things we think are important, we have to focus on our own health and be more involved in our own care. So there is a responsibility on the part of patients too. You know, I don't want to dismiss that. It's certainly not all their responsibility by any means. But we also have to encourage them to speak up, to ask questions.
Knowing what you know today, with the number of years that you've been practicing and all that you've done, what would you tell your young self coming out of medical school? What would you say?
Yeah. And I have a different style than a lot of other doctors. I'm much more interested in kind of that physician-patient relationship. But fundamentally, all doctors want to do a good job too. What I would tell myself is something that I did very much follow is be open to opportunities and be open to change. So if you met my earlier self, I would have said, Tracy, I'm going to be a surgeon. Right? I'm not a surgeon. I'm a internal medicine physician. I would have told you, I'm going to be a chair of a department at a big academic medical center. Well, I'm not doing that either. But what I hope I am doing, fundamentally, I fundamentally see myself as a doctor. And I think that's why it's so important to me to continue to see patients, to have that physician-patient relationship. So I'm impacting individual lives by helping them in the diagnosis and management of chronic conditions. But then I'm also trying to educate a broader patient population in terms of how they take care of themselves, how they understand signs and symptoms of disease. So it's really been what I've tried to do is to be open to opportunities. I've never been particularly patient, so maybe I could be more, maybe I could be more patient.
Right.
But that's one of the things I'd probably, tell myself.
You're going to be doing some work with some of our providers here in Virginia, working at community health centers. And that work that you're going to be doing is what we call CME sessions that are related to health numeracy. Okay, now we've been talking about health literacy. So what is health numeracy?
I'm really excited by that because we haven't spent enough time in the medical community talking about health numeracy. And that's one of the issues I think that would have helped in terms of the pandemic. So, fundamentally, it's really understanding math in a way to help guide clinical and health decisions makings. So when I tell you, you have a 1 in 10,000 chance of dying from colon cancer. I'm just, making up these numbers. What does that really mean? How is that relevant to other risk? If I tell you there's a 10% chance of you having a heart attack if you eat meat every day of the week, what does that really mean? Is that absolute risk? Is that relative risk? How does this help you make decision makings? And people may think, do I really need those numbers? I'd say, sure, often you do. When we're talking about anticoagulation, chronic anticoagulation for something like atrial fibrillation, based on age and underlying health conditions, most drugs have risks and benefits. Let's not forget that. So what does that mean if I told you your risk of bleeding is 1 in 5,000? But your risk of having a stroke, is 1 in 7,000. How do you weigh that? First of all, we often don't talk to patients about that because sometimes doctors aren't that educated. But I help you think through, should you take a statin for primary prevention, meaning you haven't had a heart attack yet, but you have a high cholesterol? What does that do? Is it really 30% reduction, or am I talking about a trial? So we haven't done a good job. And, people will say, I don't do math. I don't like math. I haven't done math since 6th grade. And I'll tell you, math is my 3rd grade's math sometimes.
Right.
My 3rd grader. But we have to work harder on that, because that's when we're talking about all these, vaccine trials and talking about efficacy and safety. And these are important concepts. But we haven't spent enough time in school, first of all, talking math, and then we don't often present it to patients in a way that they can understand and make decisions. And part of the problem is, again, it goes to this issue of time. We don't take enough time. Sometimes we don't have enough time in the schedule to have these conversations. But it's important because we're talking about risks versus benefits in guiding decisions that you're going to make about your health. And really, we've changed medicine that it's much more about shared decision making, as it should be with patients as they become more educated, more savvy, more interested in their own health. How are they going to make the decisions for them? And it's the doctor's responsibility to help give them some of that data.
So a takeaway here, I would say, is really using best practices around addressing your patient's level of health literacy, right? But also,
and I don't want to give out all the answers because I want people to
exactly
attend our lectures,
and then taking the health numeracy, right, as part of your practice. Exactly, it's part of your practice, right?
You can't do one
without the other. Exactly. Right. All right.
And this investment in time is well worth the effort.
Yeah.
It pays dividends later because we often have issues with medication adherence because patients don't really understand why they're taking it and what the benefit is. And we see that with high blood pressure, right? They don't feel any different. So why are they taking this medicine? They don't have any symptoms of high cholesterol. So why bother taking it? No one really explained it to them. And then they hear about a risk, right?
Yep.
There's a carcinogen or it's contaminated, but that could be 1 in a million, 1 in 10 million. But what's the underlying risk if they don't take it? What's the risk of myocarditis? Remember, we talked about that, inflammation of the heart for the vaccine. Now, that's an interesting conversation because we could say what it is for Johnson & Johnson, but then we had other alternatives, other vaccines to consider. But that's health numeracy
Right.
when you're making those comparisons. But people don't, sometimes people are a little fearful of math. So that's a challenge.
Well, and people don't really equate it with their health condition, right?
Right.
Because we don't hear it enough from our providers, like you said, right? So, in our community health center, as we kind of close out here in the Commonwealth, we have a number of community health centers and free clinics, and they often work with patients who are facing numerous social determinants of health, right? Many don't have the kind of access to the food, grocery stores that you and I do, and transportation, and then you also have language barriers, things like that. How different, given what our community health centers and our free clinics deal with on a day-to-day basis, how different is that going from a community health center to private practice and private practice to a community health center? Do you see a lot of differences there as far as what practices each of those areas would have to utilize in order to deal with the different social determinants of health?
I think we have to be realistic because we recognize in private practice that patient population often has greater resources. So they tend to be more educated to begin with, perhaps more affluent, so they can afford more services. What the issue that we need to be doing, and I congratulate the community health centers for doing this. They're terrific, is really trying to equalize the playing field, right? So how do we get access to fresh fruits and vegetables? How do we get access to, targeted medicines instead of having to have the cheaper generic medicine, which sometimes is appropriate, but sometimes not, that they can have, a medication that may have greater efficacy. We look at that in terms of diabetes care. Sometimes people are still being used on much older medicines when they could have been used on long-acting insulin, as well as some of the rapid ones. And there's some debate about whether they're really necessary or not. But we should be having democratization of access to care. So that's a whole nother podcast,
Yes,
Tracy.
right.
But we have to recognize that it's more challenging at times to do that in community health centers. It requires more resources. It requires more community and governmental support. We need to make some policy changes in terms of how care is delivered and covered. The reality is that in some ways, your zip code matters more than your genetic code in health. And several people have heard that, and that goes to the issue of, health happens outside the doctor's office.
Right.
So automatically the patient population that's being served in many of those areas have more challenges in maximizing their health. So we really need to take a 360-degree approach to it and can't think it's just about access, right? It's about the quality of care that's delivered. It's about access to specialists. It's about access to appropriate drugs and testing. But then it's about addressing those social determinants of health that you referenced as well. You can't have one without the other. But I really think we're at a point in time where we have a real opportunity to rethink and reshape how we define health and deliver health care. So I'm optimistic about how we're thinking about it. What I'm concerned is that we won't be able to sustain it, right? We're talking about equity now, as we need to, and addressing disparities. And we're thinking of creative solutions. But will we still have the will to do that in 3 or 4, 5 years? Because it's going to take at least that long to make some progress.
Well, and I think, again, Dr. Whyte, in closing, I think that's where educating our providers and our staff that support our providers in our clinics around the importance of health literacy, right? Because, we're going to be dealing with these equity issues, and there's going to be numerous social determinant of health challenges facing many patients that are served by community health centers and free clinics. And so I think the health literacy, along with the health numeracy, I think is going to, certainly help with addressing, or at least give another tool, if you will, in the pocket of our many providers here in Virginia and throughout the U.S. So, Dr. Whyte, I just want to thank you for taking the time to talk with us. You have taught me a lot, and I'm sure you have taught our audience a lot as well. I am hoping we can have you back. Again, Dr. Whyte has done some amazing things, audience, and I just anticipate that we'll be bringing him back in the future so that we can talk about some other things that he's been working on. So, Dr. Whyte, thank you for your time.
Yes. Thanks for all that you're doing here in the Commonwealth. We need this type of work, and I congratulate you for all the work that you and others are doing.
Thank you. I want to thank my guests for joining us today, and thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.vcha.org. This is Tracy Douglas. Thanks again, and I'll see you next time.